down the street, and then Elmo tell you that eat, sound and breathe, find none.
Why is something fever, DPI, why don't we have a sick that would die today? His life contain the life-making then cycles different moment gut man auditor and cut the patient model the confirmation use the institute leads to step on dignity human suspect expensive base transmit non-breaks with 23 as cosmic so flat level B density quality actualize a current state of measurization wealthy considers note level social infrastructure it can provide for the welfare and benefits of its citizenry expressed through transportation, housing, security, social infrastructure, environment, and principally the health care. The performance of the Nigerian health system has deteriorated remarkably in the last 3 decades. While recognizing the limitation of the methodology adopted and data used, it is sad and shameful that amongst 191 member states of the World Health Organization, WHO, whose overall health system was assessed in the year 2000, Nigeria's health system was ranked as occupying the number 187th position.
In the past 20 years, to be frank, Nigerian health system collapsed. That is a simple word to use.
Nigerian health system has suffered.
In the last 15 years, I want to say, I think we have been on the decline.
The health situation in the country is very bad.
Amongst the 191 countries, for Nigeria to rank 4th from the bottom is shameful for a country blessed with human and natural resources. The report of the survey based on statistics acquired from Nigeria's program on immunization, primary health care, infant mortality rate, maternal mortality rate, program on HIV/AIDS, quality and access to affordable healthcare services, and other indices. It was an alarming data. The report revealed technically the horrible and terrible state of the Nigerian health system. It therefore was a painful acknowledgement by the government and development partners of the need for a fundamental reform of the Nigerian health system. Reform must start from the ashes of failure, and to progress we must examine the present for our tomorrow lies and rise from the brambles of today. But when did the regression start? How did we get to this despicable state? What were we looking at as people and as a nation when our health system turned chaotic and decadence breeds maggot?
Health care itself is based on a system. It's just like a vehicle.
The system that will deliver health care is not there. You cannot have health care delivered to people unless you have a system in place. And the system lacks the infrastructure that will make it functional, efficient, make health accessible and affordable. That's the crux of the issue.
Attitude of the health workers towards the issues. 3, politicization of the health issues, because health is not a political issue, but people have made health a political issue. So you see that there's a level of politics among the various professional groups, there's a level of politics among the various tiers of government, and there's also a politics among even the citizens as to what means health to them and what means not to health to them.
If you go to rural areas, dispensaries have collapsed. All those small medicine places used to peddle Panadol, aspirin, those rooms are collapsed. The rooms are all taken up by cobwebs, and the nurses are doing something else crazy and selling maybe a color or something. Okay? Immunization, vaccination is no longer taking place. And that's why police having a foothold. So the system has collapsed.
Management systems are not transparent. There's still a lot of corruption within the system. And you know, corruption is a problem in Nigeria.
There's a separation between the system and the people. And my observation has been that the people are not using the system.
Nigeria has a fragmented health system in terms of we have a federal, we have 36 states and FCT, and we even said to have a local government system. But we can't talk about at national level we have 38 systems. These 38 systems are not link together effectively, they don't coordinate. And that's why you find out that the federal, the state, there are no specific delineation of responsibility. You can find out federal government going down to the LGU to go and build a health center. And you find out state government establishing tertiary hospital whereas their secondary health centers are not functioning. Or you see local government establishing a general hospital where primary health care are not functioning. In addition, there is a huge funding gap. Funding of health in Nigeria is quite paltry. The African region decided in Abuja 2001 that health should have 15% of budget allocation. Except for federal government that allocate between 6 and 7%. There is no state in Nigeria that allocate up to 5% of their budget to health. Unfortunately, even this paltry allocation, most of it goes for human resource payment, that is to pay for salaries and building infrastructure, sometimes infrastructure that are usually not completed or are not equipped or where the personnel are not enough. Hence, there's no enough fund to actually provide the services, to provide drugs, to be able to do all other logistics and what we call supply issues. The human resource problem is also a huge one in the health system in Nigeria. The manpower, Nigeria has a double jeopardy, or what we call an irony. In terms of number, in some cadre of health workers, Nigeria has more than it requires. However, these health workers are not absorbed into the system. Most of them are outside the system.
The problem of health system in Nigeria started long ago, and it has gradually disintegrated into modern disaster, potent and worse than the Greek tragedy. Lack of capacity in financing of the sector allowed brain drain, and several experienced health personnel have migrated to the West, while those that remained are unmotivated and frustrated. Medical schools are producing poor personnel. Low knowledge and ignorance reigns. People are dying of preventable illness. Poor and dilapidated health facilities abound. And stories of quackery and medical disasters are an encyclopedia. The World Health Organization says life expectancy in Nigeria is 47 years. So when you are getting near your 47th birthday, your will should have been written. You need to be in touch with the funeral homes and make plans with the undertakers. Maybe 1,000 obituary posters will be enough. How much are you leaving in your account will determine whether to buy a cow or a joko. You need an idea of the price of casket that will suit your burial. You're dying soon. Your epitaph might read, "Here lies the remains of Solomon Rabiu Chukudi, Agbabiaka, who died trying to live." And if by what may you exceeded 47 years on earth, you're living in borrowed time. Your bank will charge interest.
That modern planning and development requires that the person you are planning for should make inputs. I know one community that actually needed water and overhead tank, but they went to build them schools. They already have enough schools. They have 3 primary schools, and they don't have enough students to populate those primary schools, so they do not need schools anymore. But the effort has been made by people in government to go to the government to find out what are you need. They were told them what they needed.
There is a state in this country, very near FCT, where the state specialist hospital, the tertiary hospital that the state is constructing, is by the side of Federal Medical Center. It's a waste.
In all the 36 states of this country, you will find that there are infrastructure that are wasting. Number one, the people are not going there. Number two, there are no people there to run those infrastructure.
Because of the ruined and rustic health system, the populace have lost hopes in the medical practitioners. Spiritualists and Babalawo are the medical director who diagnose, prescribe and heal. Even family members of qualified health practitioners patronize them. A once prided and dignified profession has lost credence in Nigeria. In those days, every father wanted his child to be a medical practitioner. The word, "I am a doctor," will give you front seat, access and favor. People worship the ground a doctor treads, but now it is all history. Patient pay the transport fares of a doctor reluctantly out of pity when they meet in public transport. All the poor rats in churches and mosques are now breeding in hospitals and clinics that are shadows of themselves. In salvaging a crippled and fractured sector, government, health professional association, development agencies, private sector, civil society, and the media with the belief that only through collective and shared responsibility can we have a system that can be compared with the civilized nations of the world.
Primary health care has the mainstay for our health response during the time of Professor Olikoyere and Somkuti. And I think we need to go back again to that model where we invest, I guess, the vast majority, maybe 60% of total resources for health at that level, at the grassroots.
Putting money where it matters, so that at the primary health care level, that is the first point of contact, and it is the most important contact for those who are at the community level, and the majority of our people are rural dwellers.
People tend to make a mistake of thinking of primary health care as that small dispensary next door or outpost to the next comprehensive center. No, it's a whole philosophy and a system.
While corruption and mismanagement of resources have been identified as some of the major threats to improved health service, the populace also has a major role to play in the reform process. If people are adequately informed on information about their health and how to make quality health decisions, it will drastically reduce the disease burden. Majority of the populace do not know how to prevent or what to do when affected with common illness. As a people, we must change our attitude of government in everything and start to think on how we can protect ourselves, families, and communities. For our wealth is linked directly to our health. Only a healthy workforce can make a wealthy nation. We must understand that when the chips are down, it all boils down to your health. Politicians must change their views that investment in healthcare is a charity work and a drain on public resource because it cannot be seen or measured. But in actual fact, investment in health and education is a foundation for a prosperous and peaceful nation. Healthcare is not the responsibility of government or the Ministry of Health alone. It is about all of us and our totality.
All those who have a voice to put in a word on the need to invest in health and education, they are critical if we are to make progress, and they are interlinked. The message I want to give to everybody is that good health begins with you and I, and we must be able to do that by looking at how we ourselves are creating health, educating our family, looking inwards, making provision to educate our children on what to do.
Health is wealth. This is a maxim we have repeated often on various media, and people can talk about it, but they can't walk that talk. One thing that I know of Nigerians is that if we had a funeral today or a child naming ceremony today, we will wear one of the best clothes. But when we put on those clothes in an ailing body, then it's the misplacement of our priority.
So go for medical checkup today. Live a healthy lifestyle and encourage others to do the same. Be a change agent in your family and community. Preach to everyone that cares that health begets wealth.